Hey everybody, welcome to this week's episode of Health Hackers. I'm starting things off a little bit differently to the usual format because I want to give a shout out to this week's episode sponsor, Martin Bell, who runs a consultancy specialising in digital health and care IT. The Martin Bell Partnership has been a loyal supporter of Health Hackers for some time now, and he is personally sponsoring this episode. You can find him on LinkedIn or tweeting at martinbell1966 about all things digital health. So thank you very much to Martin, and if you or your business would like to sponsor an episode of Health Hackers, you can get in touch via the website healthhackers.uk. I'd love to hear from you. Now over to this week's guest interview. Hello everybody, welcome to Health Hackers episode 37. I am joined by a pioneer in women's health and lifestyle technology this week. Tania Boler is the CEO and founder of Elvie. Now, Elvie is the company behind the world's first wearable silent breast pump and an app-connected pelvic floor trainer. For the next half an hour or so, we're going to be discussing Tania's knack for taking on taboo issues with technology, and maybe we'll find out what's coming next. Perhaps. She's nodding if you're listening to the podcast. Tania, thank you for having me here at one of your bases in London, because the business is really growing now, isn't it?
Thank you, Gemma, and great to be here on Health Hackers. We're just in a temporary office at the moment as we're growing quite quickly.
So I should say, Tania and I first met a few years ago at a bar core class via a mutual friend, Emma Sinclair, hello if you're listening or watching, and then coincidentally, I think it was a few weeks later, I can't remember the exact date, but you then won an award, the award of the night, at a
which you were presenting
at a Women in Technology award ceremony that I was presenting, and then our paths crossed again because you were an expert panelist at a separate event where I was hosting the panel, and then I've interviewed you for TV at one of your other bases when I was working for Sky News, and now here we are on Health Hackers, and I'm thrilled that you're here. Take us back to what you were doing before you were running a femtech company.
Well, it's a good question because I've never actually worked in tech or in business before Elvie, and I didn't actually have a plan to do so necessarily. What it was is I was working in women's health, I suppose one of the main things that's similar is I was working in very taboo issues in sexual health. So I was working in access to HIV prevention, sex education, access to safe abortion. So very much sexual reproductive health services in poor countries. So I was very much working as a researcher, as a campaigner, and used to looking at how we can change the conversation on some of these issues. And there's a lot of parallels actually with what we're doing now with Elvie. So for example, with HIV prevention, when I started working in that area, it was we'd gone from a position where in the 80s there were pictures of people dying of AIDS, and then somehow they were able to completely change the language into talking about HIV and AIDS, and having celebrities talk about these issues much more openly. And all of that was sort of my background in what I'd been doing. And so basically I thought myself quite an expert in sexual reproductive health. I'd written a couple of books, did my PhD, and then I became a mother. So for any of the women out there who've also gone through that process, you'll know just how much change your body goes through. And even though I'd thought of myself as quite well versed in a lot of these areas, going through that pregnancy and postnatal period, suddenly realizing there's so much change we go through that nobody talks about, just natural parts of being a woman. And that's also when I learned about my pelvic floor.
So tell us how the pelvic floor works in our bodies, why it's such a big deal in our intimate area.
Well, I don't know, do you remember, Gemma, when you learned about the pelvic floor?
Well, I don't think I really did learn about it.
Yeah, I think for me it was like watching Sex and the City and Carrie talking about Kegel exercises. It's always either something strange to do with sex, or something like you go to the loo and can you hold yourself while you're trying to pee. And then as while I was pregnant, I went to Pilates class, and my Pilates instructor said to me, Tania, the most important thing you can do as a woman to look after your body is look after your pelvic floor. And I was like, but what is this? So I went back and I mentioned it to my husband, and he's French, and he just said, but of course all women have to look after their pelvic floor. Do women in England not do that? Just at this point I was beginning to think, why do I not even know what this is? And I started just researching it, and as I am a scientist, I was just completely shocked. So in answer to your question, the pelvic floor 101, it's a postural muscle, so it's part of your core muscles, which is linked to your posture. It's connected to your transverse abdominis, so your lower abdominal muscles and your lower back muscles. So together in harmony, they're involved in obviously in holding posture, but also other body functions such as sexual function, bladder control, and childbirth. But basically it's a hammock of muscles, so it sort of sits between your legs, and it's like any other part of any other part of your body. It contracts and relaxes, and you need to know how to exercise it properly. The problem is most women don't think about it until they start having issues, and the main issue being that it becomes quite weak. So it can be everyday activities, playing tennis, going running will wreak havoc on your pelvic floor.
So how will you know if you have a weak pelvic floor?
Yeah. Well, there's a range of symptoms. So the main ones would be often lower back pain. So 50% of women with lower back pain is actually because of a problem with the pelvic floor. Problems during sex, loss of sensation during sex. But the most common one is stress urinary incontinence, which basically is accidental leakage. So often when you hear women say things like, oh, I can't jump on that trampoline, or I wet myself laughing, or I ran for the bus and peed myself, that's when you're beginning to lose bladder control slightly. And then the health problems can actually get worse over time. So, something I'd never even heard about, I don't know if you know much about, is prolapse. And I'd never even heard, women just don't talk about it. But what you can imagine is over the years, as women get older and as they get through menopause, the pelvic floor is getting weaker and weaker, and it gets to a point where it can't actually sustain the pelvic organs, and they start to descend through the vagina. So half of all women get prolapse, and 1 in 10.
Half of all women?
Half of all women will get prolapse at some point post-menopause. 80% of new mothers have prolapse of some form, and it's not even to do with whether or not you have vaginal childbirth or a caesarean, it's just the weight of the baby is causing a lot of problems.
And 80% of new mums?
Yes, but it'll fix itself, because it's basically the pelvic floor is so weak it just can't hold things up, and then as it strengthens, which normally takes about 6 to 9 months postnatal, it'll start rehabilitating. So it's all about core rehabilitation. But because women aren't aware of this, they're not even thinking about it, they're not exercising, and also this key period postnatal, women are so busy, they're exhausted, they're looking after their baby, so they often don't think about themselves. And then 1 in 10 women need to have an operation. So I don't know if you've heard about the mesh scandal. It's a really barbaric surgery where women need to basically have a metal mesh put inside your vagina to hold things up. And it's similar to other issues in women's health. I mean, I can see your face. I was also shocked and angry that so many women are going through these issues. And what's even more crazy is when I started reading through the clinical evidence, there's really strong evidence, under the NICE guidelines in the UK government, it has an A rating, which means, the strongest level of evidence-based research showing that simple exercise can prevent and treat most pelvic floor problems. So for me, that's when I was just like, from a public health point of view, why are women not exercising? And that was the kind of whole origin of when I started looking at this issue. But swinging back to what I was talking about HIV earlier, this is when I realized, this is the kind of the aha moment, which was like, not only is it women don't have any technology, they have nothing to help them. They're lacking tools, they're lacking the means to talk about these issues, they're lacking education. And actually what we need to do is, we're never going to get anywhere if we're talking about issues like bladder, incontinence, and prolapse. And it's similar to HIV and AIDS. And if we could somehow switch it in all of our thinking into something much more normal, ultimately it's just part of being a woman. It's how we need to look after our bodies. So that was kind of the way we innovated, was with a piece of technology to help women do their pelvic floor exercise, make it fun, and just the way we launched it. So the way you and I met in Barcor. So Nikki Rain, who founded Barcor, she's been an amazing advocate. Thank you, Nikki, if you're listening. She literally, we did the launch at Barcor, and it was all about just getting it out there and saying, pelvic floor exercise is an integral part of how all women need to exercise and look after their bodies. And it helped move it from that kind of medical, yucky issue to lifestyle and prevention wellness.
And let's talk about the actual device. So anyone who's not familiar with the Elvie trainer, got one here. I'm just trying to imagine, what was it like when you began pitching for investment for this, and you had what I assume was a male-dominated tech sector, and you've got a device that is inserted in a vagina.
Yeah.
I mean, was that tricky to kind of
explain
how it worked?
People thought we were crazy. Yes, in the tech sector, there's kind of a lot of skepticism around investing in hardware products. It's much harder than digital-only products. And then the fact that this was a taboo issue that nobody talked about, and that it goes inside the vagina, was just kind of, a lot of people just thought we were, didn't know what we were doing, and it was either very niche or very weird. But it's funny how quite quickly we're able to change that around.
So if you're watching on the YouTube video right now, if you're not, go to healthhackers.uk or YouTube healthhackers and check this out. So I'm holding it up. It sits inside the vagina like a tampon.
Yeah, this bit goes inside, and the tail goes outside and talks to your phone. Maybe we can share some screenshots of the games.
You should be looking at screenshots right now.
Great.
I will edit them in after this.
Yeah, so basically the simple idea is that women don't have the confidence on how to exercise. They don't know if they're pushing down or lifting up. So there's a question about technique and confidence and skill.
That's in strengthening the pelvic floor.
Yes, and how to do the exercises. When we ask women, like, why are you not exercising? You know you're supposed to exercise. I said, well, I don't know if I'm doing it right. That was the main barrier. And the second one was like, it's boring. And third was, I never know if I'm improving. So for us, it was almost like starting with a blank sheet of paper and saying, well, look, if these are the problems women are facing, how do we help solve them? And then the other key issues were just more about context, like I never have the time, I'm too busy, that kind of thing. So then we reimagined it. We thought, well, what if you could have a product which could tell you if you're exercising correctly, could set you fun, personalized workouts so that you can constantly see yourself improving against your own scores. Take more of an exercise approach, because ultimately it's like any other exercise. Imagine if you were training for a marathon, you never knew how fast you're running or how much you'd improved, you'd give up. And then the last bit was like, how do we make this so easy to use? How do we make it really comfortable? So, soft and easy to insert, different sizing so it fits all women. But also, most importantly, so you're not having to lie on a bed in a hospital like you do with the traditional technology, but you can be walking around and getting on with everyday activities.
Because you're playing games on your phone, so you're strengthening, or you're trying to tense your pelvic floor so that you hold the Elvie trainer in place as you play these games. Yeah. So then going back to the early days, when you're pitching to this male-dominated tech sector, I mean, what kind of a reaction was it? I mean, were you did you feel like, oh, what am I doing? They're not taking it seriously, or were people surprisingly receptive?
I think, look, any entrepreneur out there, one of the key things is you have to just be so determined and so passionate about what you're doing, and just not take no for an answer. I suppose I was just pig-headedly completely determined to get this product out because I knew that it would help women. And most investors, including most male investors, didn't understand it. And I honestly just didn't care. I just decided that they just didn't get it, and I just wasn't going to focus on them. In the tech startup world, I could quite easily spend a lot of my time at tech conferences talking to mostly young male audience, but they're not the people I needed to talk to. So all I did was I kept my head down, and us and the team were just laser focused on getting out a product that we knew would really work, and then just focusing on the women themselves. And just thinking if we get this product out, the rest would follow. And that is kind of what happened, because I think women had been waiting so long for something. It's a binary issue. Some women don't want to talk about the pelvic floor. They don't want to insert something into an intimate part of their body, and that's fine. But most women we found were like just waiting for this kind of thing. So it just, as soon as we got it out there, just organically, it just grew, like it just went crazy. We kind of developed this cult following really quickly. Women were taking to social, talking about it in a much more open, positive way. And then once we'd sort of proved ourselves in that side, then it was easier to raise the money.
And actually last time we met, you hadn't yet launched the breast pump.
Yeah.
Was there anything you did differently with that device coming off the back of lessons you'd learned with Elvie? What would they be?
Well, yeah, and so also in terms of how we then got to the breast pump, so we'd launched this pelvic floor trainer, we'd proved everybody wrong, and I suppose it had been very much a passion project for me, like this is an issue that I just want to work on. But once I started working in women's health tech, I realized actually it's a much bigger space, and you take any technology product for women and you look at it closely, you realize it's not had the attention products for men have had, because there's often an assumption.
Why is that?
I think there's an assumption that women just don't really care about tech, that they're not early adopters of tech. So historically, if you're trying to adapt a piece of tech for women, it'll be on the aesthetic level. Let's make it pink, let's turn it into a piece of jewelry. and not a sense that women will appreciate cutting edge technology, and also because women's issues are taboo and neglected and therefore not talked about, and because tech companies are mostly led by men, they're not necessarily going to be the first to recognise that there's problems that could be solved through tech.
Do you think men's health tech is better than women's health tech, or do you think there's just more of it?
There's more tech generally for the male consumer, but specifically for men's health, no, actually there's not much either, because I'd say when it comes to our intimate sexual health and reproductive health, men and women both struggle to talk about it, and actually men might even struggle more than women.
What do you think needs to change for better femtech, women's technology, specifically around health, to exist?
Yeah. Well, we need, and it's happening, we need change. Things need to come together. Like I'd say right now is a really special moment for femtech, because you have these big mega trends colliding. So one of them is the huge feminist movement that we're going through right now with Me Too. That's allowing this sort of untabooing of womanhood. You know, women are taking to social and saying, I'm not going to be embarrassed to talk about getting my period or menstruation or what my body looks like postpartum, or that I'm going through menopause. These are not things that we should be hiding from society. So I think it's beginning to change, and particularly for the younger generation. And then obviously we're seeing a huge tech revolution where, you know, connected devices like Elvie Trainer allow us to have data about our own bodies in a completely new way. You know, our product, Elvie Trainer, allows women to understand a very intimate part of their bodies that they didn't know or know how to understand earlier. So it can change the way we think about our bodies.
Do you get really touched by the feedback you have from women once they've been using it for a while?
It's been incredible. I mean, it's amazing. We have women of all ages using it. You know, younger women might be using it more for general muscle strengthening or sex reasons, which is great. So they're getting enhancement out of that product, at the same time health benefits. But actually it's particularly the old women who've often had problems for 20, 30 years, and they're sort of emailing us saying, you know, they never thought that they would be able to go to work without having to stop to go to the toilet on the way, and just how life-changing it has been.
So then the breast pump. Now, what did you do differently with that you'd learned with Elvie?
Yeah, so after we launched the trainer, I realised the biggest space was tech. And actually when it comes to, if you think about what epitomises the worst of technology for women, I would say it's the breast pump. So for any of you out there who've used a breast pump before, it's often painful, difficult to use, cumbersome, noisy, you feel like you're tethered to a wall. So again, similar to what we did with the first product, we completely redesigned what it would mean to do pumping. So there's a bottle, you know, it has all the same pieces as a normal breast pump, but the key thing is that you actually place the whole product on your nipple, and you can actually put your bra over the top, and it's silent, and it's far more miniaturized than a normal breast pump.
So you can be expressing and no one even knows. You're just
completely different experience. Yeah. So women are, again, they've gone evangelical about this product. We have women on social sharing about how they're pumping and getting on doing their things.
I've seen it on Instagram. It's brilliant. I've heard rave reviews about it. Again, if you're listening to the podcast, check out the YouTube video, and you should be seeing some slides as well that are going up now that I've edited in afterwards. There was something I noticed on the Elvie website, Tania, that said, we don't do controversy for controversy's sake. Is that something that you have been accused of at some point?
I think, well, actually recently somebody said, because we've done, as I said, when you are innovating and you're launching a new product category, you have to not just launch a new tech into society, you have to deliberately change the conversation around those issues. So for us, completely changing what people think about pelvic floor, and completely changing what people's perceptions are around breast pumping, and trying to break the taboo. Like even with breast pumping, even though it's more mainstream than pelvic floor education, there still is taboo around that. Women feel embarrassed to be breastfeeding in public or pumping in public. So what we do is sort of public awareness campaigns around that as well. So recently we launched 4 huge inflatable breasts across the skylines in London. So different colours, different shapes, kind of celebrating women's bodies, but also saying free the feed. You know, women should not feel stigmatized to be breastfeeding or breast pumping in public. So no, we think it's important to push boundaries. It's one of our core values. We need to start changing the way people talk about these issues, but we're not doing it just from a marketing perspective. It is literally towards our mission, which is all around improving women's lives for health and technology.
Now that you are recognised as a leading health expert, women's health expert, If you could reach every woman in the world, if they were all listening to healthHackers right now, what kind of message would you have for them around making it less awkward to talk about boobs and vaginas?
Well, basically that it's great to be a woman, that everything we go through and everything that we experience is normal. You know, it's normal to have a period and fertility problems or problems with either conceiving or not conceiving, pregnancy, postnatal, menopause, all the things we go through, all the hormonal changes, physical changes, that we need to, I think we live in such a PC world that we sometimes forget that men and women are very different. So I think the first step is we need to be more open about them, be able to share and talk about these issues.
Do you think it will ever be acceptable to talk about periods in a just general conversation with someone you've just met? Like
Absolutely.
In the way that we talk about the weather. So like imagine if you kind of, I don't know, turned up late to a networking meeting and said, oh, sorry, I was like, I've got my period. Anyway, I mean, would that ever be acceptable?
Definitely. I think, we already have period tracking apps, such as Clue or Natural Cycles, and they allow women to understand their own periods and cycles better, but often they share them with their partners. Here at Elvie, we are 2/3 women, and definitely there's a lot of open talk about women's health.
And you touched on here at Elvie. Can I ask you for some entrepreneurial advice for people watching who might have a femtech device idea? They might be wanting to get it to market, or they might just have the concept. What advice would you have for them right now, specifically within the women's health area?
I mean, I think it's a huge open space. Like, we are just focusing on a really small part of it. And as I said, I think the whole area has been neglected for so long, and women's health are taboo issues, but issues that are neglected basically means opportunity. So there's a lot of opportunity out there still, I would say, particularly around menstruation, fertility and menopause. In terms of specific advice, the key thing with designing any product is it needs to solve a real problem. So just spend a lot of time with your potential users, and it's important to divorce yourself from that, your own personal experience, from the experience of your users. Do a lot of research, find out what problem you want to solve, make sure that you're coming up with a solution that really has a clear advantage over some of the other solutions out there. So then once you've got an idea of what the product is, the main focus needs to be the product, but obviously you need to start also raising money, building the company out there. And I think the key thing there is to be out networking, meeting people, getting advice from people who've done it before. And it really requires, as I said, a lot of determination, I'd say, and self-belief, because you will have a lot of people who will say it's not going to work, but you need to just keep going, really.
And what's the best bit of advice you've been given as a CEO?
I would say, well, Debbie Wasco from Albright gave me the advice, skin like a rhino. You just have to, if you're the kind of person, you will get rejected, and if you take that personally, then you'll never get anywhere. You have to just either ignore it if you think it's not coming from a good place, or take it on the chin, listen to what the advice is, make your product stronger, and keep evolving.
Was there any particular criticism that you've had with Elvie that you had to really draw on that advice with?
Well, I think for the first product, for Elvie Trainer, it's traditionally it's either a very medical device that you would buy in a hospital, or a doctor would prescribe, or it's kind of on the sex side, sold more in sex shops. So I think a lot of people thought we were crazy because we were trying to just pitch it as something completely new. And it's, very high risk to be innovating with a product, and even the way you sell and distribute that product. So people would say to us things like, you'll never get a celebrity to talk about this, you'll never get a major retailer to put this product on their shelves. And yet we launched on Goop with Gwyneth Paltrow, sold out really quickly. We're on the NHS, and John Lewis, we're very much centre stage.
You're on the NHS now?
Yes.
So can people go to their GP and say, can you prescribe me an Elvie Trainer?
Yeah, so what we're trying to do with health tech is, again, take it out that medical space, but you still need technology that's as good as what you can get in the hospital. So our product gives better biofeedback than what you get in the hospital. So the GP wouldn't necessarily be able to prescribe Elvie Trainer, but if they refer you on to a specialist, so women's health, physiotherapist or gynecologist, they can prescribe Elvie Trainer for free.
Wow, that's really interesting. For people living in the UK, other countries overseas, they can buy
Not for the first product, but with breast pump. So for breast pump, really our main market is the US, because their women are going back to work so early. So they, those who want to choose to give breast milk to their babies, they can actually get subsidy on their health insurance plan. So Elvie pump is available on health insurance in the US.
Was that really difficult to arrange that, especially the entry to the NHS market? I mean, I imagine that would be a lengthy process of getting something approved for NHS use.
It's fine. I mean, obviously the NHS is a huge system, but in fact it happened much faster than we expected. And I think again it's because we produced a product which was so superior to what existed in the hospitals. You know, we'd go and visit doctors in the early days and we'd show them the product, which, you know, it looked so pretty, and we didn't know how they would respond, but they were just so excited. And so we ended up creating a network of 1,000 health professionals who all loved and promoted Elvie Trainer, and they were the ones who were our advocates within the NHS.
Superb. Now, Tania, if people want to hear more about Elvie or about you, what are your social handles or website address so they can...
#Elvie or Elvie.com.
#Elvie, Elvie.com. Are you on social media yourself?
Yeah, Tania Boler, Tania.Boler.
Because I saw the Elvie one. I've been following the Elvie one for some time. And tell us, or can you tell us, what might be coming next in the Elvie line of women's health tech products?
I can't share too much, but we have just raised about $40 million, which will allow us to really scale up. So, you know, over the last 5 years, we've produced 2 completely category redefining products. What we want to do now is start working in R&D in parallel so we can launch more products every 6 months or so. So something will be coming out early next year.
Early next year, okay, so early 2020, and will it be for women?
Yes, absolutely. Our mission is to create extraordinary products that improve women's lives.
And will it be for an intimate area?
All our products are quite intimate for now.
I could just sit here and guess.
I know, it's like 20 questions, isn't it, Gemma?
I don't think she's going to tell me anymore. Brilliant. Well, check out the Elvie website, and also if you're listening to the podcast, look at the YouTube channel version, because I've put up some pictures of what the devices look like. And Tania, thank you for having me.
Thank you, Gemma.
Thanks for watching, everybody. See you next time. Bye.
Bye.
YouTube viewers, I really appreciate you watching that video. It would be wonderful if you hit the red subscribe button. It costs you nothing, and it means that you'll get notified whenever I post a healthHackers video. You can follow me on social media too. Handles right beneath me. I love hearing from you. Bye bye.